everyone. I'm Dr. Renee Mehrra. Thank you so much for joining my show that educates, inspires, and empowers its viewers. If you have already subscribed to my channel, you know that a few weeks ago, I did a show on diabetic retinopathy, emphasizing the importance of early intervention so that we can halt its progression. Diabetes, when it's uncontrolled, can lead to many comorbidities, including diabetic retinopathy when it causes damage to the blood vessels in the retina. It can cause diabetic neuropathy, which is damage to the nerves. It can also cause damage to the kidneys, diabetic nephropathy. So many comorbidities if diabetes is not controlled. And this time, I'm doing diabetic retinopathy show, managing it in the early stages through Ayurveda. Joining me today, I have Ayurvedic medicine practitioner from Pune, India. She is Vaidya Nutan Radaye. Namaste.
Namaste.
Vaidya Nutan Radaye has a bachelor's in Ayurvedic medicine and surgery from Pune University. She also has a master's in Shalakya Tantra, which is specializing in ENT, like we call diseases of the ear, nose, throat, diseases of the neck and the head. Today, I'll be talking to her how we can manage diabetic retinopathy using Ayurveda in the early stages so that it doesn't progress, because if it does progress, it can cause loss of vision permanently. Let's talk about the importance of lifestyle and dietary modifications.
Yeah, thank you, Dr. Renee. First, I want to share with you and all people that in Ayurveda, Shalakya Tantra is a special branch which treats the eye, ear, nose, throat diseases. So basically, the diseases which are in the upper class, recited in the head region, they are treated under the heading of Shalakya Tantra. And coming to your question, Dr. Rini, diabetic retinopathy is a serious complication of diabetes mellitus, and early prevention is the major plays major role in its treatment part. So, role of Ayurveda starts that the scenario is prevalence. Its prevalence is very high. So, early diagnosis and blood sugar control are the key factors in arresting the progression of diabetic retinopathy. So, after viewing the magnitude of this problem of the disease, a comprehensive and integrated approach plays important role in the management of diabetic retinopathy. Innovative alternative therapies and comprehensive approach should be tried to give better results to the patient. Now, coming to Ayurveda, this diabetes is correlated with the Prameha disease, which is called as Prameha in Ayurveda. And diabetic retinopathy is complication of diabetes. So, the Pramehajanya Timir can be correlated with the diabetic retinopathy. And basically, due to the sedentary lifestyle, there is no exercise, bad eating habits, they leads to the vitiation of the vata, pitta, kapha, these three doshas, then sapta dhatus, then srotasas. They get vitiated and they forms the basis of this prameha. And this prameha, when becomes chronic, it gives you complications like diabetic retinopathy. Now coming to, I have a PPT so that we can share the pathophysiology of diabetic retinopathy can be correlated with the Pramehajanya Timir. So you can see here, there are basically in diabetic retinopathy, there are microvascular leakages, capillary wall thickening, plasma leakages, and retinal edema, heart exudates. All these represents the kapha, pitta, vata vitiation and raktava srotas dusht. And this causes the damage to the retinal walls, retinal capillary network, and there is a bleeding inside the retina. And this represents the Urdhvaga Rakta Pitta disease in Ayurveda, in which there is a retinal hypoxia, nourishment of the retina is stopped, and to give nourishment to any tissue from the body, is the function of kapha dosha. So on the basis of all these capillary basement membrane thickening, endothelial cell damage, proliferation, and decreased perfusion, all these come under the vitiation of kapha, vata, and pitta. And all these three doshas, they vitiates the raktava srotas, that is the capillary network or vasculature in the retina. And this gives you a picture of prameya timid and urdhvaga rakta pitta, or we can say the raktagata vata. All these terminologies are related with the Ayurveda. So in Ayurveda, it is given, and lot of research is going on this, that to improve this, we have to do the treatment of the prameha involves the dietary modifications, lifestyle changes, herbal remedies are used, and therapeutic practices like panchakarma, kriya kalpas are very useful. So, due to the vitiation of tridoshas, saptadhatus, and srotasas, the prameha management should be done in the management of diabetic retinopathy. That should be followed. And this involves mainly dietary modification, because in Ayurveda also, prameha comes under the disease which is not curable. You have to take medicines and you have to put it under control, so that major complications would not happen. So prameha is also explained as a ashtau ninditiya vyadhi, means the disease which is not exactly treatable or curable. You can maintain and you can avoid the complications by taking the medicines. So it involves the dietary modification. So dietary modification firstly involves, you should take first light diet, because the diabetic persons, they just have lots of appetite, and advice is given that eat the food 2 hourly or 4 hourly or 6 hourly. So for dietary modification, you can take a light diet, specifically at night or dinner time. Then vegetarian diet should be followed. Lots of fruits and vegetables and salads should be used. And one suggestion is given in the Ayurveda, that weekly once fasting should be done to improve your appetite. That is called as Agnimandya should be treated or managed. Intermittent fasting should be there. And there should be a strict control on your the type of you are taking which diet, and you should avoid non-vegetarian diet and you should follow the vegetarian diet, because vegetarian diet is easy to assimilate, or less agni is required to have a proper metabolism of that diet.
So what foods and fruits one should be avoiding?
I think fats and the proteins, then sugary products, these should be avoided in your diet. There is a trend following nowadays, that you use high protein diet that takes care of your fats and reduces cholesterol. But it is not like that. You should take a balanced diet.
So you're talking of lentils, grains?
Yes. Now you can use multigrains, and nowadays what you can say, jawar, bajra, like that.
So millet, barley,
protein, millets you can use. Okay. Yeah, all these help, and these modifications should be done. But again, I can say that every person has his prakruti, and you should consult your healthcare provider and your doctor before changing the dietary modifications or following some dietary modifications. That I can say, because it is an integrated approach. No science is as perfect, because there are a lot of metabolism and cellular level dysfunctioning is happening in the diabetes. So You should always go for integrated approach. You should use some parameters from Ayurveda and follow again, take the medicines from the modern science also. You should continue with that medicines also for your sugar control. So that is the integrative approach you should follow. And again, you should have lifestyle changes also. Means it is a verb that early to bed and early to rise. That gives that balances the metabolism in your body. Nowadays, due to the work positions, the dietary, the whole, what you can say, um, you should go to sleep at particular time. You should not be awake at night time and watching the gadgets and TVs and other things. So early to bed and early to rise. Do proper pranayama, which increases the oxygen in your body, and do some exercises, and stress relieving measures should be done to control mainly anger and grief. They are the basic major stress factors, and you should try to avoid that by doing pranayama and other exercises.
Okay.
These are the lifestyle changes.
You also have natural Kriya Kalpas.
Yes. Then Kriya Kalpas are there. So before showing the Kriya Kalpas, I want to tell that herbal remedies are used for management of diabetic retinopathy. And in that herbal remedies, Tripala is a boon to eye diseases. Tripala is a it is a herbal product of three berries, and it has a very good antioxidant, then anti-inflammatory, anti-cataractous properties. It increases the blood supply in the retina. So Tripala is a wonder drug for all eye diseases, and this Tripala powder can be taken in on this Tripala powder can be taken by the patients or consumed with hot water. And again, Guduchi is also immunomodulatory, rejuvenating drug, which is used in the management of diabetic retinopathy. Yashti Madhu is also used. Lodra, Ashwagandha, all these, they are the stress relieving immunomodulators, rejuvenators. Then they are the nerve tonics. All these are used for relieving the retinal hypoxia and maintaining the vasculature of the retinal capillaries in the diabetic retinopathy. They are very useful. So they are used, and along with that, some herbomineral compounds are also used, like Guduchadi Kashayam, Vasa Guduchadi Kashayam, and Amritadi Bulb. They are used here in India, and they show a very promising results, and a lot of research is going on these herbal products and herbomineral products on diabetic retinopathy in India. And certain Kriya Kalpas are done to reduce this hypoxia and bleeding tendency from the vessels in the retina. That I want to show.
These are the videos that having like a daily regimen for eye care, self-care for the
Yes, yes. Daily regime that you can go ahead.
This is the Patimarsha Nasya.
So this is Tripala Gruta is taken, and it is placed in a hot water. So it is, when it is melted, the two drops in each nostril they are put, this Tripala Gruta. And this is very, this therapy is very effective.
You using Triphala Grit or you using cow ghee?
Triphala Gruta is also used, but if Triphala Gruta is not available, then you can take this cow ghee also, and you can use it properly, and put 2 drops of cow ghee in the morning in each nostril is the Pratimarsha Nasya, which relieves the stress on the retinal capillaries. Its hypoxia is relieved, nourishment of the retina is increased. all these, there are so many benefits of doing Nasya. Nasya also prevents the hair loss. It improves your hearing capacity, and it increases your vision also. So all these benefits are there of this Nasya. Nasya is a major therapy which is used for diabetic retinopathy, but that is the major procedure which requires 20 to 30 minutes, in which there is steam is given, and it is a main procedure. But this is a simplified version of Nasya, which you can use for diabetic retinopathy.
And you put warm cow ghee or warm trifla grit.
Yeah, same procedure which I have shown in the video. You can use a cow ghee, put it in the hot water and melt it. And when it becomes lukewarm, the temperature is little bit down, then use 2 drops in each nostrils in the morning after your breakfast, or you can put this in your daily regime.
And also in the nighttime? Also in the nighttime?
No. This should be done only in the morning. You should not use it at night time. And you can, if you are not getting this grita, then you can use Shirabala oil or this sesame oil can be used. If it is a cold winter atmosphere is around you, then use this sesame oil. And if there is a summer time, then you should use this grita. Cow ghee can be used, and this is a daily regime you can use. Then the second one is
Netra Pichu.
Netra Pichu. Netra Pichu is the same Triphala Gruta is used, and it is melted in a hot water, and the sterile gauze pieces are soaked in that, in the Triphala Gruta or cow ghee, if you are using cow ghee, and they are put on your eyes for 15 to 20 minutes. After 15 to 20 minutes, remove that and give a light massage on your eyes. This anybody can do on its own.
And if it goes into your eyes, do you rinse your eyes, or is it okay?
If it goes inside your eyes, nothing to worry about it, because that doesn't hamper anything inside your eye. First, then it gets absorbed from your skin, and it relieves the hypoxia and gives a nourishment, much needed nourishment to your capillary network in your in diabetic patients to your retina. And this all this improves the vision and reduces the bleeding tendency in the capillaries. This is the main regime that you can follow in diabetic patients. And this is very this therapy we are giving or managing the patients of proliferative diabetic retinopathy and non-proliferative diabetic retinopathy in India, and they are giving fantastic results. So again, a lot of research work is going on this type of Kriya Kalpas. And the next one is Padabhyanga. So again, this Triphala Gruta is melted, and we can call it as foot massage, and this Triphala Gruta is applied on the foot. A little bit circular motion should be done so that it gets absorbed, and it absorbs very nicely, very fast. If you don't get this Triphala Gruta, again you can use cow ghee. This relieves the this gives relief to your foot, and also according to yoga, the two two nadi, they come on the upper direction and they meet at the center point of the eyes, and they increases your vision, and this removes the pitta dosha pitta prakopa from your body. So this regime can be used for these three procedures can be used by the patient on its own to stop the progression of diabetic retinopathy.
So for the Padabhyanga as well, the foot massage, you can use either
Yes.
Trifla or you can use cow ghee.
Yes, these can be used. But just see that what you are in a winter time or summer time, that I can say.
So winter time you can use sesame
yes.
oil, or summertime you can use Trifla
Yes,
or cow ghee. Okay.
Yes. And all these three regime, they relieve the hypoxia and other inflammatory reactions happening in the retina, and it prevents the diabetic retinopathy from its progression. And but I am not so saying that these three are enough. You should go for the herbal products. You should do the dietary modification. You should go for lifestyle management and herbal remedies also.
I want to share with our viewers, if herbal formulations, please do check with your healthcare provider and your ophthalmologist.
Yes. So it is a complete procedures. Not only single procedures are giving the results, good results. It is a whole combination of all these things, and you have to motivate the patient to do all these things, and the patient should do it whatever he can do on his own, and try to relieve the hypoxia, stress, and other factors. And I just want to show that again in Panchakarma, Nasya, Virechana plays important role, but there are many Kriya Kalpas which are used in diabetic retinopathy according to its stage, whether it is a proliferative stage or non-proliferative stage. That also I want to show you some pictures. So this is the Netra Tarpana. It is called as Netra Basti, in which medicated ghee is poured on the eyes, and concentric rings of that black gram flour is done around the eyes, and the medicated ghee or simply cow ghee is poured on the eyes, and it is kept there for a stipulated time period. This is Netra Tarpana. It is very useful in diabetic retinopathy along with other eye diseases like glaucoma, refractive errors, diabetic retinopathy, hypertensive retinopathy, CRVO, and many things. These can be managed by Netra Tarpana in India, and it is very widely used.
Talking about Netra Tarpana, Netra Pichu. So you can take either or.
So, yes, but Netra Tarpana, for doing Netra Tarpana, patient cannot do it at home. So you will need Ayurveda physician and Panchakarma therapist there to look to get done these procedures. So these should be done. These procedures should be done under the strict guidance. And again, you have to see, and they are not. There is you can do these procedures for only 5 days, and then you have to stop that. But for that 5 days, you have to do it under the guidance of healthcare provider. Need a supervision.
This treatment is done in India, not outside.
Yes. Yeah. These treatments are done in India, and they are very helpful. Again, a lot of research is going on this, and they have very promising results in this. Again, Puttapaka, instead of ghee, this herbo mineral compound and its swaras is taken out, and it is poured on the eyes and kept for some duration. This is Puttapaka. This is also done in India. This is Ashtotana, means putting the Triphala decoction drops in your eyes. Again, it requires monitoring of healthcare provider or Ayurveda physician, and under his guidance or his or her guidance, you can do this Ashtotana. This is also called as Netra Dhavana. Then Parisheka, in this also Triphala decoction is poured, and all these procedures, they relieve the infection, they remove the inflammation in your eyes, and proper initiates the proper blood circulation in your eyes. Then this is the Anjana. It is widely used in South India, and it is very useful in age-related macular degeneration. This is Bidalaka treatment. Again, it is used in glaucoma and diabetic retinopathy in India. So all these therapies, they work hand in hand, and they are given in according to the stages of the diabetic retinopathy, along with other carbomineral compounds orally in India.
You also use Triphala rinse for eyes. You just boil the water, put some Triphala powder, and then cool it down, strain it, and then rinse your eyes with it.
Yes. Yes. It is called as Netra Dhavana procedure. So, Triphala powder is taken, and it 4 parts of water, 4 times water is put in a vessel, and then it is boiled. When it becomes the half one, then this water is taken. It is called as decoction, and it is used for the Netra Dhavana, and eye cups are used to wash this rinsing of eyes with the Triphala decoction. It is called as Netra Dhavana procedure, and it is a very effective treatment, and one can do it on daily basis to avoid the eye diseases, because Triphala has anti-inflammatory, antibacterial properties, anti-cataractus also. It is used in glaucoma in India, and so many eye diseases. Means every eye disease can be treated with the Triphala. That can I say.
What has been your success rate with the regimen that you just showed for eye care?
I'm working as a senior consultant at Dr. G.D. Paul Foundation, YMT Ayurvedic Medical College, and also at Sai Drushti Advanced Eye Hospital. So there, the patient comes on daily basis, and many patients, they have a bleeding tendency from the retinal capillaries. Even if they are taking laser photocoagulation and intravitreal injections, then also their vision is dropping down, and they require many injections. So after using this regimen of Pratimarsanasyam, Padabhyangam, the stress is relieved, and we have to advise them about the lifestyle modifications and dietary modifications. And by putting this regimen, their need of intravitreal injections is lowered, or we can say stopped, and no need of further photocoagulation. So we have very much success rate in patients by using this integrated approach, by using the modern medicines also, and along with that, give Ayurvedic medications used for maintain the diabetic retinopathy stage, and it should not go in a progression like proliferative diabetic retinopathy. And this gives very good results.
Well, thank you so very much, Vaidya Nutan Radaye, for sharing your insights into how you are managing diabetic retinopathy patients with the eye care regimen that you just have talked to us about.
Yes. Thank you, Renee. Dr. Renee.
Thank you. I'm Dr. Renee Mehrra. Thank you so much for watching. Stay healthy, stay positive.